Yes, welcome again to this session. Today is which date is today? Today is sixth, and we are going to continue with the topics that we started the other day. Very important topics. We talked about uh, traumas, and we discussed several types of traumas, developmental traumas. We talked about them. We talked about acute trauma, chronic trauma. We remember about them. Complex traumas. We define what are complex traumas. You remember about complex traumas. And we continue here. Remember about complex traumas. We haven't discussed them in details, but we're going to discuss complex traumas in details. Let's go to outline the topics that we have discussed here. We have discussed several types, and this one is acute trauma, chronic traumas, complex traumas, developmental traumas, secondary trauma, and then we have discussed historic integrational traumas. You understand what historic integration traumas are. Trauma passed down from generations. This one is a very long topic. And then we discussed about collective trauma, medical trauma, emotional or psychological trauma. We will also discuss about it. Emotional and psychological trauma. This is a kind of trauma that is involved in several issues and even the other traumas that I've talked about. So you remember about developmental traumas. When you talk about sexual traumas, this one can be part of developmental traumas because developmental traumas are kind of traumas that are carried out from generations mm, to 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 other generations. You see, now we continue with the topic of the day, and as I usually say, if you have any question, it's important you ask questions because the question can help someone or you yourself. You can be helped from what you're asking. It's not good to keep quiet and stay with your question for so long. Okay, now, what do we know about sexual traumas? This refers to sexual act or behavior that is forced upon someone without their consent, of involving coercion. We remember what we talked about yesterday. We have to talk about these words that we usually say because these words sometimes people uh, confuse them. People confuse these words. You see, mm? People confuse these words at times. Let me see. Yeah, good. Okay. Okay. People confuse these words, and it's very important we define the words that we are saying and the words that come into line with. Now we will uh, sexual traumas. We have said we are defining sexual traumas. Refers to sexual acts or behavior that is forced upon someone without their consent, often involving coercion, manipulation, threats, or violence. Get it? Threats or violence. It can be devastating psychological, emotional, physical, or social consequence. Now, what is the difference between coercion and manipulation? That is the question we really need to ask ourselves. What is coercion? Because as we say, we talk about this word, we really need to explain so that you understand what we're talking about. So let's see what is coercion. What is really coercion? You will see that coercion Uh-huh. You need to see. Yes. Coercion refers to the act compelling someone to act against their will through the use of force, mm, intimidating, or other forms of pleasure. You see, the key aspect of coaction, one, is lack of free will. Lack of free will, the person being coerced is not willing voluntarily. The person being coerced is not willing voluntarily. You see, so we continue by saying the other things that come with coercion are like use of threats or force. Use of threats or force. There is another one that is power imbalance. Power imbalance is one of it, and illegal ethical issues. Now, lack of free will. The person is being coerced is not actually voluntarily volunteering to what is being given. Use of threat or force can involve physical, emotional, psychological, financial, or legal pressure. You get it? Use of threat. That's why when we come to this word that we are talking about, that is a very big word, sexual traumas, you see, that is a very big word. And when we talk about sexual traumas, what do we really say? Hmm? Refers to any sexual behavior that is forced upon someone without their consent, often involving coercion, manipulation, threats, or violence. It can have devastating psychological, emotional, physical, and social consequences, and it affects age of any age, gender, and background. So we will see here that there is lack of will. Hmm? That person is not willing to have sexual act with someone. And then there is use of threats or force can involve physical, emotional, psychological, financial, or legal pressure. You get it? So when there is a force like physical force, you force someone to do something that is coercive. Emotional, threatening someone that if you don't do this, I will not love you. You see, that is emotional, and it reminds me of a question that we had yesterday about it. Hmm? And then we have another one which is psychological. Psychological, which it is you are playing with someone's psychology so that this person can give in to the act that you want, which is sexual act. You see, so financial, like for kids, you are always giving a kid, someone who is always giving a kid money so that he can or she can sleep with this kid. That is coercion, sexual act, which is coercion. Eh? Or legal pressure sometimes. You are married and you should. You see, those are coercion, and it is not good when it comes to. We are just trying to understand this term so that people can know how when we start discussing how sexual traumas affect other people in the real life when they are adults, someone can really know how to deal with it or come about with it. There is power imbalance. There are some people that are victims of power because you are in office, you are the person who is in charge of everything. There is a nice lady who has come, and you try to manipulate this person so that you can sleep with this person. This is power imbalance. You get it? It is not good. Someone should be taken to face the law. Illegality, ethical issues. Coercion is generally unethical and may be illegal. It is very illegal when you are coercing someone at work, at home, or where to sleep with that person. It is very illegal. Now, this one acts at any gender or background, any gender or background. And we went yesterday and we named the types of sexual traumas for which I'll name again, and then we start one by one to talk about the implication and how they 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 they, they make a person be traumatized even after developing. Now, the type of sexual traumas that we say, one is called rape. Of course, everyone knows rape, but why the way I'll explain about rape, it will be so different that people will understand how the law takes its course. We have sexual assault. Rape and sexual assault are two different things. There is child abuse, that one we know, and I talked about it below the age of 18 here in Kenya. That one, I really don't know about every state. There are some states I'm told it is 21 years of age. 21 years of age, and you are dealing with that one, you're told that this is a minor. In Kenya, we have said 18 years. In Africa, most of the countries is 18. Now, there is sexual harassment. That one is another thing. Incest. The incest between relatives involving coercing or manipulation. That one is traumatizing. eh? Sex trafficking and exploitation. We will see about that. Reproduction coercion. Reproductive coercion involving control over contraceptive methods, pregnancy decisions, or forced sterilization. You see, that is coercion, forced coercion. And then we have corrective rape. Corrective rape, a hate crime targeting LGBTQ individuals with the intent to correct their sexual orientation or gender identity through rape. I'll talk about that. And then we will go to the common signs of sexual traumas. Before now, I start going one by one about those categories. Let me give you common signs of sexual traumas. The common signs of sexual traumas are involved like flashback or nightmares. Sometimes a person will have flashbacks and nightmares. Depression and anxiety. Depression and anxiety is always here. Someone will have depression because of always thinking of the past, what has gone by. Guilty or shame. Shame that this person was involved in such kind of behavior. Self-harm or suicidal ideation. Self-harm or suicidal ideation, because this thing came public and maybe a person it feels like people are always talking about him or her. This person thinks he's unworthy. Hypervigilance, feeling constant and safe always. Emotional numbness or dissociation. Numbness. We talked about emotional numbness and dissociation from anything emotional when it comes to love and intimacy issues. Difficulty trusting other people, mostly the other gender, because the other gender or the same gender did something to this person. Physical, genital or anal injuries, that is always. Sexual transmitted disease, STIs, gonorrhea, syphilis, HIV infections, pregnancies in female survivors. This really happens when there is war and some things that are not going correct at a point. Mass confusion happens and then people take advantage. And then we are left with pregnancy in female survivors. Chronic pain, pelvic pain and headaches. You will find this person always having chronic pains and headaches. You see, gastrointestinal issues. When I talk about gastrointestinal issues, we talk about the stomach issues. And I explained how a person can get problems of the stomach. And then we have sleep disturbance. Sleep disturbance is always there. Why? Because this person is depressed, lack of sleep, behavioral. When you look at someone and you look at the behavior, what do you see? Social withdrawal. The person doesn't want to be with other people because he thinks the life was destroyed. Social, the behavior of a person who has undergone these incidences and now has been on a mile, on a road of traumas mentally. You see, avoidance of places or people. You see, if this thing happened at a gathering somewhere, when you see a gathering, this person will tend to withdraw or avoid that multitude of people or a gathering. You get it? Always, some people will end up having substance abuse because of such issues, aggression and outbursts. When you see people are aggressive, and when we are just talking and someone comes out and bursts, know that there is a problem. Sexual dysfunctions. We talked about it in sexual dysfunction, fear of intimacy, and low libido. Because when this person was uh, experiencing this the first time, or it was not well induced, it was aggression, and it came out to be traumatic. So you get to have that low libido and sexual dysfunction. Academic or work performance decline. If you are having depression that is because of trauma and is something that has been there for so long, you will not perform well at work. Even in school, in academia, there will be a problem. So these are the problems that come out. We have talked about psychological and emotional, physical trauma, and behavioral issues that come out when a traumatized person is in the society. And there is effect across different populations like children, adolescents, adults. You get it? LGBTQ, LGBTQ individuals. We are going to talk about it. Uh, and Derito, I'll talk to you. I'll see you at 6:30. I mean, yes, okay. Now, okay, let's continue. Let's continue. Very important when it comes to such topics. When we talk about these topics, now we go and start to our first sexual trauma, which is rape. Which is rape. See, it's a very important topic, and we need to define in detail. We need to define them in details. How can we define these things in detail? You see, now we have said we have said sexual trauma refers to various forms of non-consensual sexual act or experience that can cause physical, psychological, and emotional harm. These acts can affect people of all genders, ages, and backgrounds. You see, now, what is rape? What is rape? That is the first sexual trauma that we have started with. It is a form of sexual violence involving non-consensual penetration of the vagina, anus, or mouth using a body part or an object, often through force, threatening, or manipulation. And let's see this. You see, when I'm talking about rape is a form of sexual violence involving an unconsensual penetration of the vagina or anus. It involves the manhood. Maybe the woman is forcing that person to penetrate. You get it? It is not always towards the gender which is female. So you take it like that. Hmm? An unconsensual penetration of the vagina, anus, or mouth using a body part or object, often through force, threat, or manipulation. So, legal perspective, this one varies through some countries. Rape is considered a criminal offense everywhere. In most jurisdictions, lack of consent is key element. Did you say yes? Did you say that you want it? Were you in harmony with this person to do the act? You get it? Hmm? Marital rape is increasing increasing recognized as a crime globally. Because some people that are in marriages, marriages, some people may be in marriages, but the problem is they have stayed, sometimes they have issues. Maybe the woman has problems or the man has issues, but one of them is forcing the other. Because maybe one is the breadwinner, but the other does not have the capacity. So when this person has need, he or she will force her or himself to the other person. And when you go to court and you are asked, did you give a consent? Yes, this is your wife. But you see, if the wife has not given a consent, what will happen? This will be rape. Hmm? So let's talk about non-consensual penetration. The main thing here is there should be a consent. Hmm? There should be a consent. Both men and women can be victims of perpetrators. That's why I've said I'm going very slow so that people should understand about rape and about uh, the jurisdiction laws of marital rape. We have said is a form of sexual violence involving non-consensual penetration of the vagina. You understand that? Anus or mouth using a body part or an object, often through force, threat, or manipulation. Sometimes you may not force someone, but you may manipulate someone to get it. Someone who is manipulating a person to get a job. I will give you that job. You just do this and that. And this person is not willing, but because the person is vulnerable, the person gives in this process. You see, that is unwilling and it may put someone in problems. You get it? Hmm? In most, lack of consent is the main thing when it comes to this. And any penetration that you think may not be legal in court, it is legal. So we have several types of rape that we have when it comes to law and even when it comes to medical, when we are examining. Hmm? We have to differentiate what kind of this rape so that we know how to deal with them. We have stranger rape, one, acquaintance date rape. Acquaintance is a friend. Hmm? The victim knows or is dating acquaintance. You get it? And then we have marital rape, married spouses. We have gang rape. We have statutory rape, sexual activity with the minor who is legally unable to consent. You see, sexual activity with a minor who is legally unable to consent, below the years of consent. This person has not achieved the years that are supposed to give a consent to someone, a minor. Corrective rape. Corrective rape, we have talked about it. Penetrators to correct someone's sexual orientation by force. The LGBTQ community. We'll talk about it. Custodial rape. Custodial rape. Rape by someone in authority. Police guard, caregivers. You see? So those are the types of of rape that we are supposed to talk about. Stranger rape. What is stranger rape? You get it? Because you this is a person you don't know and you have just met this person and this person kidnaps you, takes you somewhere, and then you are into it. You don't know this person. You are into it, and this person just penetrates. We have said penetration, that has no legal consent. You see, stranger rape refers to an unconsensual act penetrated by an individual not known to the victim. It is a sexual assault that is considered one of the most traumatic due to the suddenness, violent nature, and lack of prior relationship warnings. You meet a person, this person just comes, forces himself or herself in you, a stranger. This is the most traumatizing thing that someone can have. Hmm? The assailant is unknown to the victim before the attack, often involve physical force, threats, or weapons. This is now a stranger. You don't know this stranger. May occur in isolated or public places, such as streets, parks, or vehicles. You see, victims may suffer from physical injury, psychological trauma, and long-term emotional effects. You see, this is a sexual trauma. Hmm? This is a sexual trauma. There is nothing like coercion. This person just comes, forces yourself on you, and then he starts. It's very traumatizing because there is no consent, and then there is use of force. Hmm? There is use of force. So there are some signs that this person, the victim, that will have, like physical injuries. When this person goes to report, you'll see physical and lacerations because they will start to fight and brush against each other. Fear and shock and confusion would trust. And there is risk of sexual transmitted infection because this person is a stranger, I don't even know. And then there is risk of pregnancy to women. So to men, there is risk of sexual transmitted disease, and in women there is pregnancy plus this risk of transmission disease. And then there is acute stress disorder. This person gets to depression immediately. Pap. Hmm? Then we have the developing one, which is long-term effect, like post-traumatic stress disorder, depression and anxiety, sleep disturbance and nightmares, because after that act, you will not have good sleep. Sexual dysfunction comes in. This is a person that you will not see him or her involve himself in such kind of emotional things and passion. You see, this person will not be passionate on having romantic relationship to someone. Or if this person is in a romantic relationship, let me say, you marry someone, you get married to someone, you are in a relationship, even not married, you find out that when you are trying to 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 ask this person you need this in the relationship, you get it. Hmm? When you're trying to tell this person now, when you're trying to tell this person it's okay, all I need is we have stayed for so long, and at least you have me, give me, let's bed this thing out. This is your person. This person is adamant. At times, when you talk to him about sexual relationships and such encounters, this is your partner, the partner starts to cry. You've been with people in relationships that the people don't, they feel confused and they feel bad when they are getting into this relationship, sexual relationship. The person will tell you, yes, I do love you so much, but I don't like this thing. Don't be confused. Find out about past traumas, because now the past traumas may be the one that are making this person not to be okay on coming out and making out with you. It is not that maybe this person has someone else outside, but you should look, because many relationships and marriages destroy because of several things, like they have you should look at some signs and symptoms, the ones that are we have said. Hmm? We have said physical injuries, these are immediate. Fear, shock, and confusion, risk of sexual transmitted. But in long term, you have a partner who is always depressed and anxious, has sleep disturbances and nightmares, and sexual dysfunctions always. Sometimes fear of strangers or public places. You will find that this person is undergoing something. This person is undergoing something that you really need to take care of. And what is this thing that this person is undergoing? Because if this person is seeing someone else, this person will not have PTSD, this person will not have depression and anxiety. Sexual dysfunctions will be there with you, and sleep disturbances and nightmares will not be there. But a person who has encountered that and is drawn in her or him, he'll have sleep disturbances and nightmares, fear of stranger or public places. If you ever encounter a partner who is like this, please see and look up at this partner of yours. Don't say that this partner mm, so don't say that this partner is cheating on you. No, the partner is not cheating on you. It's just that she is carrying traumas, sexual dysfunction, and now we are talking about rape. You get it? Rape. Hmm? There are some management that we really need to to undergo when you notice a person, because there in rape there are some things that we really need to understand when it comes to management of rape. It's a sad situation, and we really need to know how to encounter hmm, this situation. You see, in details, this is an illegality. And if it is an illegality, how can we work out and try and help this person? It is a medical emergency and a legal issue, and a psychosocial trauma patient. This is a psychosocial traumatized patient. Management should be holistic, timely, compassionate, and systematic. Ensure safety, dignity, and confidentiality of the survivor. Not that you this person goes at home, then you start shouting to everyone that she was raped. Or you go to a hospital as a doctor, you meet this person, you start shouting how are you raped? Hmm? Uh, a person like you who can be raped, as people are listening. Don't judge people. Immediate prioritize first contact when this person is getting first contact. Remove the survivor from the place of danger. Hmm? Always keep privacy and confidentiality about the matter. Use a private room. Avoid multiple staff around there. Non-judgmental staff support should be there. Show empathy and avoid blame. Who blames are like, what were you doing at that time of the hour? Hmm? Those are the blames. Sometimes you start asking a person like, at that time of an hour, what were you doing there? And who are you with? No. Avoid blame first so that you can try and assist this person. You get it? Hmm? Apply empathy. Informed consent before any examination, test, or report. Tell this person there's some information and some examination that I'm going to do, and I want you to sign here an informed consent that I told you I will do A, B, C, D. And you see, survivors can be any gender, mm, and they can be in shock and distress. Medical management. Always, when you find someone is mostly for medics, always use open end question, non-leading questions. Open. mm, Like, do you think those people knew you? Mm? Do you think they were following you? What can you say about this? Let the person explain further for her or himself. You see, details of physical force, penetration, use, condom use, ejaculation is very important. Did they use a condom? This one we will know at least they try to protect sexual transmitted disease. Did they use force? Did they penetrate? Very important. What kind of force did they use? Did they show you a gun? You became traumatized and you gave in? Did they beat you up before you accepted? Look at the clothes. Do they have some blood spots? Hmm? In females, always ask last menstrual periods. Always ask last menstrual periods. Last consensual sex. Ask, because this person may be coming from see a boyfriend, then the person is again sexually harassed by being touched and not penetrated in, but he'll go report, and then the DNA will come out from the samples will be of the boyfriend. This is a very tricky situation when it comes to medical examination and checkups. So the person who was the trauma inducing person will be free, but the boyfriend will have problems. So you should ask these questions. Use of condom, last sexual encounter that was consensual, history of menstrual period, because pregnancies, we don't want them after rape. So what do? We give an emergency pill to protect. I know this is against some religions, but now me, I'm talking as a doctor. Hmm? I should talk like a doctor now. What are the current medication, contraceptions, and allergies that you have? You see, do a physical examination. Perform only with consent. Don't, I'm talking to medical practitioners, don't perform without consent. If it is a lady, have a chaperone by your side. Even if it is a man, you know you can get yourself. You saw about secondary traumas that we carry, some professional carries after doing some jobs. So don't be a medic and neglect these little things. Even policemen, these professions always have a chaperone. If you are a man and you are examining a person who is a lady, a person who's just come to report a rape, please have a chaperone by your side. Examine for injuries, bruises, cuts. This is a rape. Genital traumas. Now this is examined in examined in this is examined by medical practitioners. Sign of struggle, fingernail scratching, torn clothes. Look, and those people. Let me tell you, when you are a victim, always tell people that when they encounter this, don't remove the clothes. Go with the clothes. Don't wash yourself. Go directly to police or hospital the way you are. Because the person you meet, this person will document the findings as it is. You get it? Because the sexual assault evidence form will ask all this. findings, and this person will need to document. Hmm? Forensic evidence collection, only with consent and idea within 72 hours of assault. 72. So if you go to hospital, they'll do a vaginal, anal, or oral swab. They'll check on the clothing, foreign materials to get the other DNAs, to get the perpetrators, hair and fibers, blood and urine samples, very important. You see, now there are some treatments that you really need to get when you encounter such problems. These treatments are like STI prevention, antibiotics. They did not use protection, so we use antibiotics. HIV exposure prophylaxis is important. Emergency contraception, very important. Tetanus if there is wounds, and hepatitis B, which may penetrate and you start having. Now, this is the real deal here, because we are dealing with mental health, and here we have a psychological person, a person who is psychologically affected. How do we handle this? Immediate counseling, validate emotions, explain normal trauma responses, offer ongoing trauma informed therapy, or group therapy, refer to mental health professionals if signs of depression. You see, PTSD, PTSD, suicidal ideation. It is very traumatizing to be to be traumatized in both ways, physical and sexual. Living with this thing is very traumatizing. So you will find some people are struggling in life, not even performing well at work or in school or anywhere they are trying to, because they are even relationships, because they are always depressed and they are undergoing PTSD. PTSD, it means post traumatic stress disorder. And sometimes you marry a person is beautiful, you love this person or handsome, but this person is always depressed, and you get to realize that he has post traumatic stress disorder because of rape. And sometimes you feel that the person has a good job, everything is okay, but one day your partner asks you that, is this life really worth it? Hmm? You see, this is a kind of developmental trauma that has come from somewhere, a trauma that has built and grown for some time. So when it has grown for some time, what do you do? Therapy. You don't break your marriage or your relationship because of this. This is an encounter that someone has got, and this one you're the one to correct. Hmm? Don't get don't get someone traumatized, sick, and then you try and not to assist. It's better you try to assist so that you can get a good version of that person. You understand? So when it comes to depression, PTSD, and suicidal ideation, it will often tell you that this person has undergone several things that you really need to work out. And you see, you may not realize it when you are in a period of courtship, because this is a place that this person has masked the trauma that he has undergone. This is a time that this person has gone through some several issues that he or she will not show you. But you see, the time of living together is when this thing comes. Or at time when you have stayed with a person in a relationship for some time, is when this thing comes out. You realize that this person at times is so aggressive. You realize that this person at time does not want to speak to you because you are the opposite gender. You get it? You will notice that marriages have broken like this and relationships. And it is very important to note that trauma that is developmental and traumas that are related to such things like rape, it is not easy to heal, but therapies heal them. So I usually tell people, don't break the relationship. You were in a relationship with this person for some time, you have stayed with this person for some time, you have noticed these signs. It is time to help your person to move out of this and be a person you will like you to be, the person to be. You understand? Because if you move out of the relationship and you claim that this is a relationship that you are caring about this person and loving, you will not help this person. So, depression, PTSD, and suicidal ideation, when you notice them, when this person has been having this, what you really need to do is, is to form group therapies, get professional for this person, work with this person. This person will one day come out of this trauma and you will enjoy together. You get it? The fourth one here, we have psychological support. We have come from prophylactic treatment, psychological support. We go to legal and documentation support. Legal and documentation support. Provide a medical report using national templates. In Kenya, we have something called the assault form, which we call it P53 form in Kenya. Report to police only with survivors' consent. If a person comes to your office, you are a medical assistant, you are a doctor, you are a health worker, you need to report when the person has consented, except in minors. A minor you have to report. A minor you have to report. Hmm? Mandatory reporting. Unconscious or mental incapacitated victims you have to report. Chain of custody for forensic sample must be preserved for legal use. If you get a sample, what do? Those clothes samples that have taken to the laboratory should be preserved. That's why when there will be something called forensic examination by the legal team, those things should be seen and examined. Hmm? Provide a referral to legal aid services, e.g. gender-based violence centers. This helps so much, and they really help when it comes to follow-ups. We are dealing with trauma, and trauma is a case of mental health. So we are trying to help this person mentally and even physically. I started with the prophylactic treatment, that is physical help, so that this person cannot get the problems that we get when we engage in sexual act diseases. And then I went to psychological support, counseling, and group therapies. You see, and then I went to legal and documentation support. And when it comes to legal and documentation support, now don't be involved and get in as a secondary perpetuator. You don't write required issues when it comes to this. This required issues, form of the police, report to police with consent from an adult who is said. But for minors and unconscious or mental incapacitated victims, please report. Don't be coerced with someone. Report. Chain of custody forensic samples must be preserved. This is now legal documentation. Provide referral to legal aid services or gender-based violence centers. Very important. Now, follow-up care. follow-up care, 1 to 3 weeks. Assess physical recoveries. Side effects of medications that have been taken. Hmm? Side effects of medication. 4 to 6 weeks. STI testing, very important. HIV, serology, VDRL for syphilis. These are antigen tests. These are antigen tests that helps a person to do what? To to know that. Just a minute, a minute, a minute. To do that, to know that. Uh, sorry. Yes, these are tests that we will know this person did not contract this problem. You get it? 3 months. Repeat HIV testing. Hmm? Repeat HIV testing. We continue. We continue, guys. You repeat HIV testing for 3 months so that we can be sure that there was no transmission. But you had, and the people, if the perpetrators are arrested, we have to do a test because these are criminals. Now, we have special considerations for children involving trained pediatric and child protection teams. See, you can get that there is a relative who has been doing this thing or people around that this child need to be isolated to be protected. Use age appropriate language. Sorry. Mandatory reporting is very important. Sometimes, if someone is aggressive, when someone comes from a rape and goes to, he may be confused and become aggressive at times. It is important you sedate, but that one needs a legal team to approve the hospital or somewhere else because you cannot sedate at home, always sedate in hospital. For male survivors, provide same respect, care, and legal support. Recognize male-specific stigma and trauma. We have noticed that so many men are being raped, but they cannot report. Why? Because they are traumatized. They are traumatized of saying in Africa we say a man cannot be raped. If you go and report that you've been raped and you are a man, what do you think will happen? Hmm? People will laugh at you. People will say that you are a man, you have to stand strong. You cannot be raped. How can you be raped? You see, a very funny thing. But you see, it is a legal issue, and this person is undergoing trauma just as a woman. Now, what I'm going slowly in this because it will involve other rape, sexual traumas that you have gone through. Hmm? Involve medical officers, nurses, and midwives when this person reports. Counseling and psychology. This is a multidisciplinary case. Social workers, police, legal liaison, child protection officer if it's a minor. You get it? So the steps in management here is first aid and safety, history of exam, evidence collection, medical care, psychological support, legal support, follow-up care. You see, that is the steps taken when it comes to rape. Hmm? So we will go to the next one, which is acquaintance and date rape. You see, this is a person that this person knows and has gone and has not consented. So what do we do about it? Hmm? What do we do about this acquaintance date rape? You see, refers to a non-consensual sexual activity where the penetrator is known to the victim, such as a friend, a date you had with a person, a coworker, or a neighbor. Someone met recently, including via the social media. Hmm? It differs from stranger rape in that trust or familiarity may exist. You get it? Between the survivor and the offender. So, if it is between the survivor and the offender, what do we do? Key features here include private setting, home, dorm, car, party, hotel, hmm? Somewhere you planned to meet, may involve coercion, manipulation, intimidation, or substance use. You're given alcohol a lot or a spiked drink, then you black out, then you you get in yourself to the act. May not involve physical violence, but consent is absent. Victim may feel guilty, confused, or self-blame. Frequently undergoes unreported due to fear of not being believed. How could you go just meet a person, or this is a person you always hang out with? How can you tell us you were raped? You see, eh? A person forces pressure to a person on a date. A known person takes advantage of the victim is drunk and high or unconscious. The survivor is verbally threatened and emotionally manipulated. Sex continues after the victim says no or resists. Hmm? These are the things we should check on. Examples of date rape scenarios are these ones that I've said. Hmm? Why is it often not reported? Why? Why do these people don't report? Because survivor fear they won't be believed. You are drinking. You are invited them in. Survivor feel shame of confusion due to knowing the perpetrator. Pressure from peer, family, or community to keep quiet. Hmm? Means like if you didn't fight back, it wasn't rape. See, some things are, you may feel that these things are normal or they are not illegal, but now you find out that these things are illegal. Psychological impact, severe emotional trauma, especially from betrayal or distrust, depression, anxiety, post traumatic stress disorders, and relationship difficulties come in here. Because now you went and drank, you didn't talk to your boyfriend or your husband, something happened, you are always guilty when you are having someone you love. You see, may have long-term impact on sexual emotional function. The way just have explained before. Hmm? Medical and legal team management here. Immediate, ensure privacy and supportive approach. If this person tells you the steps are the same. Immediate care, history and examination. Medical intervention, very important. Psychological support, very important. Legal consideration, very important. I've explained it so slowly. Hmm? You see, difference between this one and rape. There is no force. You get it? Marital say now we go to marital rape. Marital rape. How does marital rape occur? Hmm? Some people have been taken to court and people get confused. Why was the husband jailed? Why? And this is the the husband. There are some things you should know when it comes to marital rape. Because, just a minute, my network is hanging. Let the technicians do what they need to do. Why was the husband really taken in and it was a rape? Why? We have talked about marital rape, and we have said this is rape non-consensual between spouses, hmm? By spouse or ex-spouse. You see, ex-spouse even included. It is a form of sexual violence that occurs within the context of marriage, where one partner forces the other to engage in sexual activity without consent through physical force, threats, coercion, or physical intimidation. Very funny, right? Occurs within the marriage, legal or traditional, that is a marriage. Consent is absent, obvious, may involve physical violence, often unreported due to stigma or cultural problems. How can you tell us you are raped by your husband? It is because you're not doing your job as a wife or a husband. That's why you should always be ready for your husband. You see, those are the things that come out. Occurs within marriage, consent is absent, may involve physical threat, manipulation, or emotions. I will not do this if you don't. Often underreported due to stigma. These are the characteristics. Forms of marital rape: force only rape, minimal physical violence but involves sexual coercion or pressure. Battering rape include both physical abuse and sexual assault. Obsessive sadist rape include degrading, humiliating, and torturing this person, hmm, in sexual act. Legal status: in many countries, marital rape is now recognized as criminal offense. Hmm? It's a criminal offense to force you, your husband, your wife to this. And the injuries, always, you'll find this, it will involve physical effects like genital injury, sexual and unwanted pregnancies. Chronic pain is always there. Physical effect: post-traumatic stress disorder, depression, and anxiety. Low self-esteem, suicidal thoughts are always there. Social effects like isolation, stigmatization, breakdown of trust. It's there. Why victims may not report is because fear of retaliation, economic dependence, shame or guilt is there. Cultural or religious belief, lack of legal protection because this is they consider this a marriage. Hmm? Management is always the same. Medical care the same. Treat physical injuries, screen and treat STIs, provide medical and contraception, psychological support very important, counseling, therapy supports, crisis and intervention. Legal assistance, legal advice on protection on ordered separation. Social support, very important. Prevention and advocacy, public education, empowering women and men economically and socially. Legal reforms, training new laws, very important. Community engagement is very important. You see, marital rape, people may take it as a marriage and someone is suffering. Now, we go to gang rape. Gang rape. I want to finish all these rapes today because tomorrow we have another topic that is coming that is at least medical. Kind of like medical because it's the effect of of mental health to physical behavior and physical deterioration. Now, gang rape is a form of sexual violence that two or more perpetrators are sexually assaulted by the victim simultaneously or sequentially. Is often characterized by violent simulation and physical trauma, involves multiple offenders, and it is non-consensual. Hmm? Can involve even video recording, sharing, and public shaming. Most behind gang rape is motives behind gang rape. You'll find that motives that are behind gang rapes are power and control, peer pressure, revenge, hmm, dehumanization, sexual gratification. You see, most of this, when you go to report, these are the things that force people to do it. Power and control. Some people, when they are overwhelmed with power, they can do things that are not okay. And you see, these things, they are mentally disturbing some people. These things, they are not good to the society. Hmm? Gang rape, revenge. You send people to do it, to revenge. Hmm? Sometimes you want to revenge and make that person feel that he's a lesser person than you because you are in power. And sexual gratification driven by violence tendencies. These are illegalities. Hmm? You see, common context here, you will see many people that are going to wars, conflicts and wars. They do that to the other people that are fighting when they get their women or their men and they want to revenge. This is what happens. In schools or university, peer pressure. See, these are minors that don't know what they are doing. Gang gang initiation of street activities. They are these are criminal institutions. When they use alcohol and drugs and they turn into a character of an animal, you want to do some things that are not. You see, domestic or community setting where victims' vulnerability is exploited. There's some people that travel away from home and then they meet people where they went to work that are not they have used alcohol, drugs, and then they have turned into something else. That is criminal. In the victim, you will find severe injuries in genital and body parts, internal organ damage, sexually transmitted infection, including HIV, because you don't know this pervert, this person that is doing that, who else is sleeping with. Unwanted pregnancies, psychological and emotional consequences. You see, depression comes in, anxiety and panic attacks. When you see a group of people, you are worried because you relate a group of people with whatever you faced. Nightmares, hmm, guilty and worthlessness, suicidal ideation. You always have ideas of suicide. These are There are things that happen and people keep quiet. And some people who do things like this have power. But even if you do it because you have power, psychologically you yourself you are affected because you don't know what you are doing will affect you personally. Hmm? You see, social consequences like stigmatization and rejection from communities. You find someone because the story was known, he cannot find a partner to stay with or to have a normal relationship because people start asking this person, why are you walking around and having this person who was gang raped? Stigmatization. Hmm? So people tend to avoid you. Breakdown of families and community relationships. You see, someone may run away because now the shame has been so much from the community which does not know how to handle this. Fear and mistrust of others people. Fear and mistrust. Hmm? You see, this is particularly harmful because multiple attackers increase brutality and power imbalance. Victim often feels isolated and helpless. Higher chances of severe injury and mental trauma is there. Fear of retaliation and perpetrators, also known as powerful, more likely to involve public humiliation and blackmail. You see, blackmail will always come here because if a person does something, he is doing it behind some powers that he thinks are powerful than the person who is being perpetrated. You see, gang rape is considered as aggravated from a rape in most legal systems because this is the most bad thing a person can have. In Kenya, it is addressed under Offence Act 2006 Sexual Offence, Section 2. Let me read it and you will hear how it says our constitution here where I am. If two or most persons rape or defile a person, each shall be liable upon conviction to imprisonment for term not less than 15 years and may be life imprisoned depending on severity. Each perpetrator is held individually and jointly accountable. You don't say we were with this person in court, you will be judged personally as a perpetrator, not as a multitude. You see, now we go to management because that is what is we are discussing. Management for these victims, you see, medical intervention very important, and I'll continue. HIV post-exposure prophylaxis is very important. Screening STI is very important. Emergency contraceptions, don't want pregnancies unwanted. Forensic evidence collection should be preserved. Psychological support, crisis counseling, trauma-focused therapy, long-term mental health support, legal support to police, protection order, legal aid or advocacy organizations, very important. Witness protection is needed here. Social support, safe shelters or relocation, community and peer group, very important. Reintegration assistance in the society. Reintegration, I'm talking to how to help this person to go back to the community and start living a normal life as she or he was living. Prevention strategies like community sensitization, strengthening law prevention, teaching bystanders intervention techniques, encouraging safe environments, very important, and empowering victims. You see, empowering victims is very important. Now, we go to statutory rape. Statutory rape. We have talked about this, and this one we have said this one is about minors. Statutory rape is about minors. This one you have to report if you are the first encounter. You have to report it. Be it what and what. It is here we cannot compromise. We have to report it. It's a legal term of referring sexual activity with a person who is below age of consent, even if the appears consensual. When if the act appears consensual, see that the person has given you the right to consent, but the law states that the person has no right to consent anything. So this one you have to report. The law assumes the minor is incapable of giving informed consent on sexual activity due to their age. So the perpetrator should be taken to legality. Age consent is very important. 18 years. You see, now I read the consensual age of the minor. We say the consensual age, children under a person who commits an act with consent causes penetration with child is guilty of defilement. Penalties: child under 11 years, life imprisonment. Hmm? Child age 15 to 11 to 15 years, that is 20 years. Just imagine. Aged 16 to 18 years, 15 years. So anyone with 11 years, you are imprisoned for life. We cannot talk about you. You have to be imprisoned. Hmm? We cannot talk about you. You see that? Hmm? It is taken based on age. And we will not talk about the consequences of the offender. Now, the consequences of the victim, teenage pregnancies, unsafe abortions. You have seen young children goes for abortion so much. STIs and HIVs, infections at children. Psychological effects like depression, anxiety, trauma, shame, guilt, hmm, school dropout and poor performances. Social impacts like stigmatization, early forced marriage, isolation from peer and family. Very important when you note these things. You may note these things to a child, and then you come close to this child you talk to, you'll find out something has been going on or something happened. Handling the report is step by step. Ensure safety of the minor. Withdraw that person from the environment. Seek medical care immediately. Treat injuries, administer emergency contraception, and like start post-exposure prophylaxis for HIV immediately. Report to authorities, police, chief, children officer, where you are. Hmm? Preserve evidence. Support based services. And when I'm saying preserve evidence, I'm saying avoid hand washing, avoid washing or changing the clothes. Go to hospital for forensic examination. That is very important to children. Support services, gender-based violence recovery centers, children department, legal aid clinics, counseling and rehabilitation centers that are trained to handle children. And sometimes people may say, you see how the body of that child is big and they were in love. How? This is a minor. You cannot be in love with a minor, no matter how consensual it is. The minor agreed. No, how? The minor agreed on what? The law states this is a minor. Hmm? It is not rape if there was no force. Who told you so? This is a minor. The law states it's a minor. Girls only are victims. Even boys are victims a lot. So you don't have these misconceptions mostly. See young people that are being coerced into things that they shouldn't be facing. There are so many counseling groups around that help minors when it comes to rape issues. Professional when it comes to minors. We should take our children that are traumatized in this way to those counseling centers. Don't find anyone and give a child for counseling. Find a place that is a professional place that people are trained about counseling and people are trained especially on kids, on children, to handle the children as it is supposed to be. Hmm? So we have talked about several types of sexual assault, and now there is this one called corrective rape, corrective, also known as curative rape, is a hate crime where an individual is raped because their actual or perceived sexual orientation or gender identity, particularly targeting lesbians, women, gay men, or transgender individuals. So you do this to tell this person because you hate the other person. You know there is several ways of helping a person. There are several ways of helping a person, but a crime to help is not helping. So here you'll find a group of people or a person, they'll go to rape someone to tell that person, you are not doing this. This is the way you should be doing it. You understand? Even if the law of a certain state states that they don't tolerate LGBTQ or lesbian, gay, or men or transgender, even if the law states that, you as the perpetrator, you are doing a wrong thing. You get it? If the law states that we don't want ABCD in this country, you let the law deal. Report, let the law face them. Don't do something that is an illegal thing, like uh, physical trauma, or going to sexual manipulation or sexual insult, so that you can show this person you are living the long life. Hmm? And what are the key characteristics when it comes to this? Motivated by prejudice and hate. You hate gays, you hate gay lesbians by passion. Is often divided by homophobia, transphobia, and patriarchal beliefs. You see, there is a good way of helping people, but not sexually assaulting them or physically assaulting them. Mostly this targets the LGBTQ individuals. Most victims are lesbians and transgenders, especially in conservatives or high gendered society. Traditionally, high gendered society or conservative traditional societies, rationalized by perpetrators, believe that forcing a heterosexual act will convert these victims to be a so-called normal gender or sexual identity. By you, the person forcing himself to a person who is a gay, or forcing yourself to a person who is a lesbian, trying to make that lesbian to know this is the man. You see, it is wrong to perpetrate an illegality to force someone to stop doing an illegality, or to stop doing something that is out of nature. You see, this is where people are confused. Corrective rape. It is called corrective rape. Often occurs with form of violence because this person has not given consent. You go there with violence. And what does this thing do? Because your tradition does not allow this thing, you are heads high saying that I'll say I was corrected. It will cause trauma to that person. There are so good ways to help this person to change to a normal person, but not to force yourself sexually to that person. Because that person will have double trouble, trauma of being forced into, and trauma of living the life that she is living as a gay or lesbian, and being not wanted to the society. Depression, anxiety, and suicidal ideation will come in. This person can commit suicide. Double trouble, sexual transmitted infection, physical injuries, loss of trust. Hmm? There are some countries who are really prevalent on this. Hmm? Often unreported. You cannot report because the fear of shame, lack of legal protection for LGBTQ. You see, this is LGBTQ is not nature, and many states does not protect that group. Even if some people have done some wrong things to them, if they go to report, they are seen as the ones who started it. And in real sense, you, the perpetrator, you are trying to change this person in a with wrong motive. Hmm? You cannot change a wrong with a wrong. Try to get the right to change the wrong. Even if you feel LGBTQ is not wrong, get the right manner on how to go about them. Because some of them are raped, and killed. Some of them are raped and left with bad wounds. This person has been living a negative life according to nature. Now, having double trouble means the person is torn down to nothing. We don't want to tear people down to nothing. We want to change the perspective, aspect, and characters to be the right one. So use the best way on how to help these people. Don't force yourself sexually to these people. Hmm? And then they become stigmatized when they go to police to say that I was molested or sexually molested. They start laughing at that person to say, asking, telling him, you are the one who brought it to yourself. Hmm? It's very sad. Problems upon problems. Prevention and support is important. Psychotherapy is important to these people so that they can know you can live a normal life by not being an LGBTQ, and also you were traumatized. We are helping you to move away from this plus that one. Counseling, shelter, and medical support is very important. Training law enforced and healthcare providers on LGBTQ rights and trauma informed care centers. You have a right as a man and a woman, but you don't have a right as a transgender in some states. Hmm? You see, nature is nature, and it was written by the person who brought us to life. No matter how you try and change nature, you are the one who is bringing psychological problems to yourself. So you don't use an illegality to change someone who is doing the wrong thing. Use the right way to change this person. Informed group and counseling can change someone to be a better person. That one, the treatment is still the same: counseling, post prophylaxis of medication, therapies. Counseling is very important when it comes to medical attention. But there is the other one, which is the last one, which is called the custodial rape. Custodial rape refers to rape committed by a person in a position of authority or custody, such as police officer, prison guard, military officer, and institutional authorities against someone who is under their control. Hmm? Occurs in custody for institutional settings, police station, juvenile homes and rehabilitation centers, minors, military camps. Here you will get power imbalance. This person always forces yourself to him or her because he has power and is under your custody. Victims may be detained legally or illegally. Someone may detain you illegally or they can take custody of a child because this person wants to be molesting this person. Hmm? You see, consequences always ends up to depression, PTSD, and anxiety. Physical harm or injury is always there. Because if you force yourself to someone who is not ready, there is no wetness, there is no what will happen? This person will end up being torn, having lacerations, blood coming out, STIs will go in, fear of reporting threats, retaliation, a lack of access to justice because you are under someone who is under custody. You are under custody. Hmm? This is whereby the international communities comes in to protect the person. Because you see, a person under custody is under people that are power, have power. Hmm? This one may carry harsher penalties due to abuse of trust and authority because we trust you to be taking care of this person. And why are you doing this? Hmm? You see, a woman raped by police officer in custody for questioning. We trusted this police officer, and now this police officer is inducing trauma to this person. A juvenile sexually abused by a guard in detention. very bad. Hmm? There are some things that we induce. Person goes to jail and then comes out traumatized. We should really think about it. We should really do something about it. The mode of treatment is still the same: management, psychotherapy, post rape prophylaxis, get to a hospital, hmm? Sexual traumas. Now, I've talked a lot about traumas, I've taught how to deal with this reporting, and we have seen how to avoid some issues even in marriage. This topic has ended today, sexual traumas. If anyone has a question, always my email address is there. Post it there, we discuss, and we get to know how to deal. Next time, we will talk about physical consequences when it comes to mental health issues. And here is where we will discuss about diabetes, hypertension, all those chronic problems that people have that affect physical. Thank you so much on coming to the platform. We meet tomorrow at the same time that we usually meet. If you have a question, always pin it on my email or call me. Some of the people here have my number. We will see how to help wherever you are. Welcome and have a good day. Let's meet tomorrow. Big up every time.